As Louisiana starts its partial reopening, we're taking a look at doctors' biggest concerns now regarding patients, plus why one doctor says COVID-19 is a wake-up call for everyone to take better care of your health. Joining us now, North Shore physician Dr. Chad Domingue with more on that. Thank you for joining us.
Thank you for having me. Always a pleasure.
Okay, so a lot has happened since we last spoke to you. There's the partial reopening. So what still concerns you? Is it delayed surgeries or particular patients still not coming back?
Yeah, I think the best way for me to answer that question is with a story. I'm still doing telemedicine, and I had a patient, this was last week. He was told around February or March that he had major heart disease. He was told that he needed 4 vessels in his heart stented. And he was kind of pushed off a little bit. But now, that we have reopened elective surgeries, I talked to him the other day and he said, "Doctor, even though I know my heart is in bad condition, I'm still scared of this virus." So he knows, and his doctors are trying to schedule this surgery. He understands how severe it is, but he's still having this fear of a virus. And, I tried everything I could as a physician to say, I understand the virus, I understand why you're having these concerns, but you need to listen to your physicians and understand that your heart is going to kill you faster than the virus will.
So your advice to folks, I know you said in the past it's probably safer going to hospitals now than to go to some big box retail store. I remember you telling me that. Is that still your message?
Yeah, it's still my message. And again, I always want to bring up the doctor-patient relationship. I encourage, patients to listen to what's out there, to listen to the risk factors that are associated with this virus. But at the end of the day, they can't take their focus off of things that are imminent risk to their health. And I use that heart analogy, and there's many others. And it's not to say that his fears are unfounded of this virus or other viruses, but he needs to make educated medical decisions with his physician to decide what is the riskiest to his health. So I encourage all patients that are dealing with chronic medical problems to really understand the risk of not dealing with their medical problem versus this virus.
Yeah, because I know you said that you're afraid a lot of other diseases will end up killing people than COVID-19 if they put off seeing their doctor. What are some of the things you want people to focus on to do a better job in terms of taking care of their health, and which patients specifically?
Yeah, when you look at the virus, I think it comes up with 4 main risk factors: hypertension, diabetes, lung disease. So diabetes, hypertension, lung disease, and uncontrolled of these disease processes. And when you're dealing with something as severe as COVID-19 and this pandemic, we have to look at, as Americans, what can we do to make these disease processes better? Eat healthy, exercises, because, we're being told we're going to have another virus in the fall. We know the flu comes every year. And just as I educate my patients, my staff, my children, focus on the things that you can control. We don't know when the vaccine's coming. We don't know if it's coming. We lost 80,000 to the flu this year with Tamiflu and a vaccine. So if we focus on the things that are 100% in our control, such as weight loss, such as exercise, such as healthy living, it gives us our best fighting chance for any disease process that comes to us.
So you're saying quit smoking, eat better, exercise, those things help reduce your risk as we continue to face this amid no vaccine.
Yeah, look at this as a wake-up call. We've been told our entire lives what the right life choices are and what the things that we should do that keeps us healthy. And I think when you have something this severe that changes all of our worlds, you have to take it and take the positive from it. And the positive that I'm taking from it, and I'm echoing to my patients, is reevaluate your lifestyle choices. Reevaluate what are you doing to your lungs, to your diabetes, your hypertension. How did you get to that position where you were in that patient population that is at most risk for this virus? And I think that's important, because as our world moves on and we continue to deal with other healthcare threats, it is those kind of decisions and lifestyle changes that is going to give us our best fighting chance.
Yes. Thank you so much, Dr. Chad. Appreciate it.
Absolutely.
Thank you.
Absolutely. Always a pleasure, Liz. Thank you.
Thank you.